Welcome to Functional Roots, where whole body wellness begins in the mouth. I'm Amanda.
And I'm Heather, and we're hygienists with a passion for all things holistic, functional, and naturopathic.
This isn't your average dental podcast. Around here, we dig deep, past the plaque, and into the powerful connections between oral health, the body, and the way we live.
So whether you're a fellow dental professional or wellness enthusiast, or someone curious about how to take a more natural approach to your health, you are in the right place.
So grab your favorite herbal tea, settle in, and let's get to the root of it all.
And today I'm so excited to be introducing my dear friend and partner in crime on the oral systemic connection, Dr. Karen Plymel.
Hi, good morning, everyone. It's so good to be here.
Yeah. Welcome. All right, Dr. Plymel's journey began in a small rural town in the South and has since evolved into a distinguished career serving the greater Detroit area. She earned her Doctor of Medicine, MD, from Ross University School of Medicine and completed her residency in obstetrics and gynecology, becoming board certified in her specialty. Her passion for whole person care led her to pursue advanced training and fellowship through the University of Arizona, Andrew Wells Center for Integrative Medicine, and the American Academy of Anti-Aging Medicine. She holds multiple board certifications in integrative, anti-aging, metabolic, and nutritional medicine, and is currently board pending in aesthetic medicine. Dr. Plymel is widely respected for her ability to unravel complex health conditions using advanced diagnostic tools and a highly individualized approach. She integrates conventional medicine with evidence-based alternative therapies to address the root cause of illness and help patients restore balance, resilience, and long-term vitality. With a deep belief in the body's ability to heal, when given the right support, Dr. Plymel partners with each patient to co-create a roadmap to vibrant, sustainable health. Alrighty, let's get started.
Yeah, going to be a unique conversation. So Karen and I work very closely together. I met her through Bristol Health. She is not in the dental field, so we are in a great collaborative relationship where I get to do oral microbiome consults for an hour with her patients. So do you want to just start? You're in the medical field. You kind of joked with me, you started in OB and never thought you'd be testing this hole, the mouth. So tell me, Karen, how did you get started with the oral systemic connection with everything that you started looking at for your patients?
It's a great question, Heather, and I'm really, really happy to be here today. I really didn't know what to expect, so I really like this kind of free flow approach. And I hope all of you will kind of like my little humor that I put in every once in a while, because fun humor is so important right now that we do. So how did I get down this track? I'm not even sure how I got to OB. It was a lifelong passion of mine. And I've changed and kind of evolved over the years of what I am today. And what I am today, I couldn't be if I wasn't where I was before. So I guess long story short, I got to go back to my roots for that one, Heather, to answer that one really appropriately. I come from the deep South where people don't really like doctors, right? A lot of wives' tales. So I think I kind of was raised with more of an integrative mindset. And then I really had a passion where I wanted to help people. I wanted to fix people, I wanted to repair people, whether that was psychologically, spiritually, physically, nutritionally. And over my years, I just keep evolving as a lifelong learner of medicine and humble what I don't know and take it to the next step. So how I came about Bristol is I couldn't fix the people anymore. I came up with a program with the help of Metagenics, and we thought we were really doing great things because everybody's talking about the GI microbiome. So this program that we put together was helping people for the most part, but I got stuck. So about 5 or 7 years ago, I used a different company. I said, let me go upstairs. It can't be all about the microbiome. Because if we're going back to the GI microbiome, we're going back kind of like traditional medicine's done, and that's silo work. And I just don't believe in silo work. You can't do any of this alone anymore. So collaboration, silo work, I had to bring in a different part of my practice. So I went upstairs I listened to my patients, number one. And my sickest patients had the sickest mouths. And that really rang true to me because for part of my career, about 12 years, I did high risk OB. And I started seeing this pattern of my sickest babies, my sickest women had the sickest mouths. But there was very, very little in traditional medicine about that. But one of my colleagues' husband was a dentist. So I started talking to her a little bit. Then I left that field, came into this field, and I just kept seeing it over and over again. And the things that I kept seeing was sinus, postnasal drip, and mouth problems. And that led me back here. So 5 or 7 years ago, I started testing with a different company. I lost hope. I thought I'd gone to granola. And my patients would look at me like I had three heads when I brought up the oral cavity, right? No one had heard about the oral biome. And I'm like, well, no one ever had heard about the gut to brain axis either. So I'm like, we can change this.
Mhm.
So I found Bristle. I don't know how I found Bristle. I think I was looking for a different company. And I remember signing up every Monday with Heather. And I said, you're going to get tired of me. And sure, and I had to push past that because I am that person where I don't want to, I do like to push boundaries. And I'm like, I'm stalkish. I'm a little stalkish right now. So basically, I fell into this because I stalked Heather. And every Monday morning, I find someone to meet with her. And I was so intrigued. And then I would take the information from the Bristle and what Heather was teaching me through that time. And I'd go back and I'd look at my functional medicine test kits. And sure enough, what was in the mouth is in the gut, is in the brain. So slowly I started changing my practice. I'm getting ready to revise it. That every person that sees me has to have an oral biome test. Every person that sees me has to have some imaging and sleep or airway study. So that in a long, long way, Amanda, to answer it, that's how I got here. It's been a long 30-year career to get here, but I'm here now. And I will tell you, it's put a lot more passion back into what I do.
That was almost exactly what I was going to follow up with. I feel like once you start connecting the body together is when you realize all of those pieces are coming together and it clicks. And there's so much passion there when you just see everything come together and you're addressing the root causes. Kudos to you, Dr. Plymel, for being such a lifelong learner and for exploring the mouth. I am really curious though. You said a couple things in there. You specifically said that you noticed your patients that were the sickest had the sickest mouths. Obviously, as an OB, you're not looking at that hole, as you said. How did you connect that? Because you're not looking in the mouth. How did you know that they had the sickest mouths? I am super curious about that.
Because I couldn't get them better. I couldn't get them better. I'm like, this is not making sense to me. Right? I can heal the gut for a while, but then they get sicker again. So I just had to keep thinking my way through it. And I didn't have a lot of mentors in this area, other than my relationship with Heather. And then I didn't even know how much she could teach me working with the company, right? So I just had to keep questioning. The curiosity brought me to it. And that's what I think does make me a lifelong learner is the curiosity. And I don't think you can do integrative medicine if you don't have that same curiosity. So that's how I came back here, Amanda, is I couldn't figure it out. I couldn't get people better. And here's the real truth. I listen to my patients. I've always been known to listen to my patients. They taught me more in the opposite side than the other chair than what the books ever taught me. So they brought me to it. If I'm really going to give credit where my career is, it really are the patients that's allowed me to grow. And they stuck with me, Amanda. I was green. Talking about green, I mean, when you go from occupational therapist to massage therapist, then you go back to OB, and then you take a risk at integrative medicine, you just keep taking, you keep pushing. So that's how I got here. My patients lovingly watched me grow, helped me evolve, gave me grace when I stumbled, gave me grace when I didn't know the answer. But you guys led me here. That really is what led me here.
Awesome. And I think it's so incredible to be working with you. I refer so many individuals because I can't get the oral microbiome under control if I don't have the systemic stuff under control. So it's really wonderful to have a doctor on the same page on where the oral systemic connection is. And Karen and I have honestly had a really hard time finding dentists who are in the same understanding of that oral systemic connection, especially with root canals. So let's dive in a little bit with the imagery that you are requiring and the airway and what you're finding there. But I know what we're finding, but what sort of imagery are you looking for, and have you found is lacking in a lot of different offices?
That's a really good question. And again, I want to make it really clear I'm not a dentist.
Yeah.
I'm thrilled to be learning as I'm coming through, and I'll never be a dentist. And I want to respect that boundary. I want to be collegial in there. Heather, you guys have taught me so much about CT cone beams. And again, for the audience, I'm very wet behind the ears in this space. I'm growing as rapidly as I can. Excuse me if I blunder along the way. I am so impressed with the CT cone beams and the amount of information that you can get. And I've had some reads that's comes my way, like anything else that's a poor read, right? And then I've had some great ones. But the amount of detail of the CT cone beam is like something I've never seen. You can't, a CT in the traditional world or an MRI doesn't even touch it. So I think part of that is the imaging that dentistry has created, but also it's the radiologists that they have reading them. And that's true of any part. So my favorite thing is the CT cone beam. I'm not quite understanding why x-rays are still being done. Maybe you ladies can help me understand that mentality. I also don't understand why we have this great imaging tool that's not read professionally consistently,
Yes.
right?
Short answer, insurance reimbursement.
Well, and not all offices have a CT cone beam.
Yes.
So with the differences in, teaching the medical side of individuals who might be listening to this. So I hope we start bringing in some individuals like yourself. But the differences between x-rays that we do in the dental practice are CT cone beam is a 3D image. So we can move in and out of the tissues and the sinuses, and we can really get a really good picture of root canal teeth. We can look at the bone for cavitation issues, which are stealth infections that can impact health. We can look at where that implant might be placed and how close it is to the sinus cavity, and how that impacts, like Karen said, when we are testing the oral microbiome, she's finding these bacteria also in the sinus. So we have to really start thinking about the safety and the placement of implants, but also how that root canal might be communicating with the sinus and those. And then we can look at deviated septum, and we can look at the airway capacity of our patients with a 3D cone beam. Completely different imaging. Bite wing x-rays or PAs are really close views, and they give us good information for caries and really close information for assessment of periodontal disease where we have bone loss. So we need those really close images that are 2D to assess if we have a progression of disease with periodontal disease, because the 3D cone beam just doesn't give us that much information there, or caries, because the 3D won't give us that image either. And then there's the pan. Honestly, I think the pan could be replaced with a 3D image there's really, at this point in technology and dentistry, I think the pan is probably completely obsolete when we have the imagery that we have. So following protocol, our general standard of care is we should be taking a full series of x-rays. So that's either a full mouth x-ray where we do individual PAs and bite wings of all the teeth to show up close for disease progression in a screening once every 3 to 5 years. And then bite wings should be at least once a year. It could be more frequent for someone who's high risk for bone loss or caries risk, or you can stretch it a little bit if you don't have those risk factors for some patients. And in holistic dentistry, sometimes they do stretch that a little bit. If we don't have those close-up images, we are kind of viewed as negligent if we're not doing that for that. So that's kind of explaining for the medical side of individuals who might be following this podcast, the differences between all the x-rays that we take. And Karen and I are finding really, really cool information that are helping our patients really understand where the oral microbiome is going through the rest of the body. And airway is really important for our patients systemically as well. And finding a dentist aligned with our thought processes behind some of the root canal issues that we're seeing. Cavitations, we've had a few of our patients with cavitation issues, and then airway is always a conversation with our patients that we're treating together. So I love the collaboration on the medical side, and really she's teaching me amazing stuff because I get to see the functional tests that she shares with me and putting 2 and 2 together in that perspective. Karen, what are you hearing from your patients from a dental side with what you are kind of educating them on what they're getting for dental care? Can you share?
Yeah, Heather, I'm going to come some mixed reviews.
Yeah.
So number one, people don't expect when they come in for hormone therapy that they walk out the door with an oral biome test. Okay. that they're getting used to words getting out, but that's how I practice. But when I really sit down with them, after I get them over the resistance phase, they're very embracing, but they're getting a little bit angry. Some of them are. They're starting to question a lot. Well, why are you doing this? Why isn't my dentist doing this? Why doesn't my dentist know about this? That's what I'm starting to get a lot of questions back from.
Yeah. And oral microbiome testing isn't, I mean, there's a lot of options out there. Like you said, you started with one company. I think, and I'm partial, but I think Bristol, especially on the medical side, gives us so much more information because we're not just looking at pathology that causes gum disease and inflammation, but we have, I think I've learned a lot by looking at your mold testing. I just had 2 conversations this week on actinomyces, and those being exceptionally high in the raw results section and saying, hey, that's a waterborne leaky house problem when we have actinomyces at the top of the raw results section. You probably ought to have your house checked for mold, because if you have gut and brain dysfunction, those actinomyces groups show up on a mold test. And we probably ought to look at the mold test. So I'm learning the systemic side, which is so incredible from you. So I think that collaboration goes 2 ways. It's fun.
And that's a really important thing that you brought up, Heather. I started making that connection too. And then again, I thought I was going a little crazy. I'm like, all these mold patients that I'm seeing, all these cross species, I'm like, are we really that closely intertwined with our environment? And what kept coming back to me is, yeah, because so many of us are mouth breathers.
Yep.
So we are taking and inhaling all of that in, sinuses, mouth, and it is changing that entire and impacting that. And when patients start to see that, they can't unsee it.
Yep.
So mold the breakpoint. And the more you start to see it, and sometimes I wonder if I'm looking for it, but I don't think I am. And to come up with that independently, Heather, I think that's again a testament of where we're all going with it.
Yeah, for sure. My conversation this week was one with a dental office. Their test looked beautiful, but when I went into the raw results, the top 10 in there, I think there were 6 actinomyces at the top, and he reported severe bleeding. I'm here for my bloodletting for my office. And I was like, I usually don't teach this part through Bristol, but this guy's a mouth breather. So his bleeding is probably coming from mouth breathing, and he probably has a mold problem. Lived in Seattle area, so rain. So I was like, you're not, we can do SRP all you want, but unless we treat the mold, that's highly inflammatory. I think he probably needs airway assessment and probably mold and gut treatment.
Yeah. And probably the two least favorite things that people like to do, right? Work on their mouth and go to the dentist.
Right.
And work on their sleep. No one wants to wear a sleep appliance. So we've got our challenge. We've got our work cut out for us in this space.
Yes, absolutely.
We definitely do. I want to kind of dig in. You guys mentioned something, Dr. Plymel. You said, why, like your patient's response was, why is my dentist not doing this? And that is, gosh, I think kind of, I think it's the beginning of a conversation of what is going on in dentistry right now. We kind of touched on it a little bit in our pre-conversation, our pre-show conversation of kind of what is the road that dentistry is going down right now. And I think that there's going to be some very interesting paths that dentistry is going to go down. There's going to be offices that are just trying to survive the current relationship that they have with insurance. And these offices are never going to start doing any sort of testing. They are just in survival mode. And then I think there's offices that, whether it's the dentist is passionate, the hygienist is passionate, maybe they start having a health journey of their own and kind of have this realization. I think those are going to be the offices that really start looking at this pathway of wellness, not just oral health. I mean, I think hopefully we can get there. We, again, like Heather said, we've always looked at oral systemic. We've always talked about it. But now with the integration of the potential relationship that we have with functional medicine, like it's here. Like this is how we can grab it and really make a change in our patient's health and take our provider mentality to the next level. We're not just the tooth scrapers, right? Like Heather was saying with that patient, you can scale and replane it all day long. You could laser that, you can arrest in that, whatever you want. But until we address that whole body, that whole person, you're going to be guessing and just doing what you can clinically, and you're going to see, minimal results, and you're going to burn out, right? You're going to get discouraged that you're not effective. Maybe the patient's going to get really frustrated, but maybe also that hygienist is like, oh, but this patient, maybe they don't want to pay the $180, $200, whatever it costs for testing. Maybe they aren't empowered in their office to have that conversation, to bring that up, because there are so many patients that will say, well, I just want to do what my insurance covers. I want to do the bare minimum. So I think there's a conversation there for sure, where how can hygienists be empowered? Because we don't have autonomy in most states. We don't own the practice. Sometimes hygienists are very well respected in their practice, and they are an actual part of the care team and treated that way. And not just as, well, this is the role. I just need you to do your x-rays, get me in for the exam, and diagnose some dentistry to be done. And I think that's been a huge, huge problem in dentistry, is we have put hygienists in a box, kind of been told like, go to your room, do this, come get me when you're done, by our dental counterparts. And I really think like this is a potential fork in the road for where we can be as dental hygienists, as oral health coaches, as providers, is okay, we can be this integrative health provider to educate you, you educate us, and we can really make change for our patients. So I don't know that I had a question there, but just the conversation of being used in this way is just such a new conversation in dentistry. So thank you for valuing medical and dental and the integration of just everything that you're saying is just truly refreshing to hear from a medical perspective.
Yeah. I want to jump in a little bit, Amanda, with that. Just listen,
Please.
I start to think about some things. And when I first came on, I thought maybe my job is to encourage the dental hygienist to educate the person, but maybe my job right now is to encourage the dental hygienists that are listening to take that opportunity and maybe change the lens of what you're doing. You really aren't just sitting with that person and cleaning their mouth. I think what we have to do is help everyone see that the mouth is probably the most important part of where you're at. And you might be the leader of changing the face of dental and medical by that few minutes that you're spending with the patient in the chair. You've got them in the most vulnerable time. Their mouth is open, they can't talk, all they can do is listen, right? So I really do think to impact change and to not get burned out, maybe I need to motivate all of you by thinking about what you're really doing, right? And that's discovering disease process. I'm convinced that oral diagnostics is going to be as important, if not more important, than blood, salivary, or urine, or imaging for that. So it's just a place we haven't looked at. And I've changed my lens on what dentistry is. And I tell my patients this every day. I no longer look at my dentist as a dentist. I look at them as an orthopedic surgeon. They are drilling in the places. That sinus cavity lies very closely to the upper portion. And I always tell my patients, and I'm probably going off on some tangent right now, but I always tell my patients there's only 6 ways to get to the body: sinus, mouth; gut to brain; rectum, cervix, skin. The ones that you easiest to get to is oral and sinus. So you guys have a great opportunity to educate yourself, to stay passionate while you're educating the public.
And we're unique in the field because not everybody gets 45 minutes to an hour to sit and have a conversation with our patients and educate them about the oral systemic connection. We have a unique position to be able to do that, and we need to be utilizing that extensively and educating ourselves. There are over 3,500 articles on the oral systemic connection. We've been preaching it since we went to hygiene school. And physicians like yourself and hygienists like Amanda and I, and some of our followers are discovering the power of that. And I think it's important too, like, we can see vitamin deficiencies in the mouth significantly. Or, I just had a meeting yesterday with another functional doctor. She consults with me once a week. And I do a slide presentation for her on specific topics. And we covered the oral gut connection and Crohn's, people with sores in the mouth, or cheilitis or glossitis, bumps in the back of their throat. Cobblestoning is what it's called. That's a sign of Crohn's. And we can, if we start working collaboratively and we're saying, hey, I'm seeing excessive sores and we have cobblestoning in the back of the mouth, I'm getting angular cheilitis with our patients, we really need to start looking at the gut health of this patient. I think they have Crohn's, right? So it's super important. It's fun to be educating, like, the oral microbiome and how that impacts Crohn's disease and IBS and SIBO and SIFO. But then also we have the ability to look at those symptoms in the mouth and say, hey, I think you need to be seeing someone like yourself who is looking at that functional aspect. And I refer most of the time to functional doctors because I want to get to the root cause of why. I don't want someone going on a PPI or medications to treat SIBO or SIFO issues without really adapting nutrition and healing the gut, not just throwing antibiotics at it and saying, looks good, right? Or they go to get an endoscopy and, they end up on a PPI for forever, which leads to vitamin deficiencies. So we need to be working collaboratively when we're in the biologic side of things and looking at the symptoms with individuals like yourself who are looking to actually heal our patients and not just slap more medications to cover symptoms.
I think it's so many great points there, Heather. You cannot fix this body. You can't get the body in an optimized state. Fixing is probably a bad word. You can't optimize this body if you don't look at the oral biome. You just can't. There's just no way. And I think about this with medicine. Why not the mouth? It's right there. It's right there for the taking, right? You can do salivary pH testing. You can do oral biome testing. You can look in it. You don't have to go to sleep and have anesthesia. And you can start to map where you think the body's really going to go. So the mouth is the best opportunity, and the sinuses with the nasal swabs, and they go hand in hand. So I think it's just prime. I think we're really at the beginning. And whatever you quoted, Heather, I forgot the number that you quoted, how many articles or research studies are out there. I would dare say you could easily quadruple those. I think we're just getting started.
Yeah.
Right.
Yep.
And for all the people that's listening, Heather and I are new under our relationship. So we're starting to track different oral pathogens for different disease processes. Are we seeing more? Are we seeing trends? Are we seeing ties into things? What's working? What's not going to work? And so as we move forward, we're getting close to really coming to where we're starting to see our patients and the outcomes of the dental intervention. So that's going to be super exciting.
Yep. and hopefully we'll be speaking together. we
Yes.
we have submitted for a conference in the medical side on collaboration for one of the individuals we're working with for the oral systemic connection. So we're kind of in that pioneering, like, we have to be working collaboratively.
This
So,
is what the next step has to be, right? Because
Yes.
we've been talking oral systemic, like I mean, we went to school, what, 20 years ago now? And of course, we were talking, oh, oral systemic, like this affects cardiovascular, this affects brain health. But there's like, what is the next step? It's always just been, oh, tell them to see their doctor.
Mhm.
And there's such a gap there. There's such a gap. And I knew nothing of the biological side of things years ago. So what you guys are doing in this relationship, gosh, this is patient care. Like this is absolutely what patient care should look like. I wish I would have had this, right? How long ago as a patient, somebody looking at whole mouth. Why was it so acceptable? Like, why did insurance get this final say that our mouth and our eyes are magically not part of our body? And why did physicians only start looking at the mouth as a way to take pills to get medication in the body? Like, why was there just such a disinterest in the mouth and just how it's not important? Like, it's just truly, it's so weird how undervalued it is in Western medicine, because that's not the case in Eastern medicine or any of the ancient cultures or any herbalists or any Ayurvedic practitioners. Like they see value in oral care. Why in the world did our culture decide, no, no, it doesn't matter. It's fine.
Part of it's a time factor, Amanda. If I'm going to be really honest, I don't think my colleagues really push back on the concept. It's different for them. They're open to it. It's time. And some of them are like, I've spent 15, 18 years of my life sacrificing just going through traditional school. I don't want to keep learning. So I think that's multi-layered. It's a time factor. It's a get them in, get them out. It's definitely a business structure. And the business part of medicine is just getting stronger. Private equity keeps coming in. I don't know what that looks like in the dental association, but they keep knocking at our door all the time. So and most of your hospitals are run by accountants. So you do have this mismatch. Well, and I'm glad we do have those people, right? If we don't have CEOs or numbers people running, I would never be in practice because my heart is so good, right? I don't have a business mind whatsoever. Thank goodness I have my co-owner Tracy to help me with that. So I think that's part of it, Amanda. I'm going to give people a little bit of a grace. I think they don't understand the value of it, right? I think we did push things into a silo, right? And then, and honestly, what Heather and I can do, and Heather, I don't want to speak for you, but I think the more we tie all that research into a story, into a human journey. Hey, Amanda came to me with what she thought she was hormones. And I sat down with her and I really felt that it was her root causes more. I found autoimmunity. And autoimmunity has to come from the mouth. So I think again, as we move forward and we bring these cases, again, man, I'm just picking you out, not that you're really my patient, that really happened. But my point is, as we grow together these stories and we introduce where you were before we started, we brought your mouth intervention and where we took you from just changing that part of it. I think that's where there's such a disconnect. We haven't taken and made that clinical connection. The science is there. It's putting that clinical connection together.
and
That's a phenomenal point.
Yeah, and I think even dentists and hygienists, struggle with that aspect too, right? We were never taught how to manipulate the oral microbiome. We were taught to just obliterate it, right? Here, slap some Listerine on it. Here's some chlorhexidine, and that impacts nitric oxide reducing bacteria. Another thing that we can test for. And our patients with high blood pressure, oftentimes their nitric oxide reducing bacteria are really low in the body, and it increases blood pressure risk. Well, we're throwing those patients on, high blood pressure medications, but what if we shifted the biome a little bit better and had, a better nitric oxide reduction process? where that assists our blood pressure patients. I mean, it's all interconnected. It's super fun. And I do think I'm excited to be working with you, Karen, because I do think we're on the verge of discovery even more, because the oral microbiome, they've only been looking at the main bacteria, which are the red complex, orange complex, and green complex. That's what most of the salivary tests are looking at. It's super exciting to be working with you and actually looking behind the scenes on some other stuff and pulling some data on those types of species and how those are impacting IgG, CRP, and interleukins. And those impact systemic inflammation and liver, fatty liver, issues and insulin resistance and all of those factors for our patients. So it's exciting to be on the forefront, I think, of discovery with the medical and the dental together. And I'm excited to share together on that journey.
And I think so accurate, Heather, everything you're saying, and I made it back for you. People in my field, again, we really want things to apply, right? Most physicians are not research oriented. They're not the PhD. We don't rely on that PhD. We want information pretty quickly to know how to impact our patient Monday morning. We go to a conference, the same thing for all of you, right? And another thing, man, I want to just go back to have a little bit of why this is such a hard area, because the human being's hard.
Mm-hmm.
It never follows textbook. So it is super interesting. It is super fun. And I do think we're on to something that's revolutionary.
I couldn't agree more with you guys on that one. I'm excited for you, and I'm excited to get to be part of this conversation, honestly, because I feel like this is going to reignite so much passion, right? A discussion that is in our community is burnout, huge burnout rates for whatever reason, and just lack of respect from our counterparts in the dental community. Having this, I don't want to say alternative space, but still being able to use your education as a dental hygienist and getting to impact patient health in a different way to create meaningful change is so exciting and just engaging, because like you said, we want to make impact, right? We all got into this to help other people. We love what we do. Like you said, Dr. Plymel, like a patient is not a textbook. There's lifestyle factors that we cannot account for. And you in a 20-minute appointment with your patient is not going to get to the bottom of those.
Mm-hmm.
In an hour appointment that we usually get with our patients, we're still not going to get to the bottom of everything, because we don't always get to talk lifestyle factors, right? We might like scratch the surface of some medical history things, but maybe not lifestyle. I have a patient, she's pretty severe perio. I've been seeing her 4 years, I guess. And I do have the privilege, I work in a small community, of getting to see her whole family. And she's older, she's still working, but I saw her son recently, and I expressed to him my concern of her declining mental state. And he kind of filled me in on what her home life looks like. And it was like, oh, okay, this is a whole other thing that I can't brush and floss her way out of this. There's just certain aspects that we can't control. But anyway, I digress on that. But just there's so many factors to people that we cannot control. And I think it's really interesting to be able to step out of some of the boxes that we've been put in as hygienists to start having more impactful change in patients' lives.
And go back really quick about the burnout. Is there a lot of burnout for the dental hygienist? Because there's a lot of burnout in my area.
Absolutely. Absolutely. And I think the less mentally engaged and challenged I think a hygienist is in their practice, the faster they're going to burn out. If it is just all about production, all about numbers, if there's just no gratification there, it can get really monotonous really fast. If you're not finding that gratification of either seeing change or whatever it is, right? We're all a little bit different on what fuels us. There is such significant burnout right now. I think we had mentioned this a little bit, but pre-COVID, there wasn't quite a shortage of hygienists. And now, the ADA is making claims that there's shortages of hygienists. And there's debate on our side of things if there is actually a number shortage of hygienists, or if there's just a shortage of hygienists that are willing to work in certain conditions anymore. So you ask a very good question. Yes, there's burnout, but I think there's people that are either afraid or not sure how to take that step to not find burnout and are looking for other professions to answer that void, that issue that they are finding professionally in dentistry.
How do you avoid that burnout? What are you missing in what you're doing that you had before? Because you went into this for a reason, right? And the reason I asked that question is I think there's some ways that maybe we can get dental hygienists to feel valued again, right? But if you're just there in the chair cleaning, that gets a little monotonous, I would think, day in and day out and day in. So how do you give your colleagues the incentive, the motivation to continue to do what they really came into the field to do?
Gosh, every hygienist is going to be so different and have a very different answer for that. I've been a hygienist 18 years now, and I'll be honest, probably the first 12, I think I only made it through because I had to pay bills. I was a single income earner. I wasn't married, so I had a mortgage to pay. That's what motivated me. I am now at a place in my practice where I'm not being micromanaged by a dentist telling me that I have to do, X, Y, and Z to make their practice run. And I think there's a lot of hygienists that are literally put into a box and told what they have to be. And you don't get that fulfillment of, I am getting to do what I love. Maybe you don't feel like you're meaningfully contributing to the practice and to your patient's health. You're just too scraping to fill that quota. And something that I have been allowed to do, which I was honestly very surprised. I worked for a DSO, which is a dental support organization, and it is a private equity owned practice now. But I have a very decent amount of autonomy. I don't have a dentist breathing down my neck telling me that if you don't treat the patient this way, that way, or whatever, that patients are going to leave because of me. And that has happened before. I've been fired from a position because we weren't getting a lot of new patients in. I'm like, well, you're not doing any advertising either. But there's a lot of pressure on hygienists because most of the time in most states, we're not owners and we're not vested in the practice. We are literally just an employee. And that can be very monotonous, very tedious if you don't feel that connection, or I don't want to say have skin in the game, but you don't feel like a meaningful member of the care team. And that is truly, I think, what will make or break your career is if you can find that way that you are getting to meaningfully have an impact in patients' lives and be a provider in the care team at your office. Honestly, I've been at my office, it'll be 5 years this year in November. And it's honestly the first time in my life I've ever been called a provider. And it was just like, what? I'm a provider? And I've never felt more empowered. It's not a biological office, but I'm able to implement some elements of it into practice. Taking blood pressure. If you want to talk about patients saying, oh, is this new? What is going on? That most offices are not even doing that. That's such a strong way to start a conversation. pH testing. That is a very strong tool, very cheap, very strong tool. Heather calls it stripping. So that's a fun thing to start.
I strip my patients
in her
on a
office.
basis.
It's such a powerful way to start conversations because we know not every patient is open to it. Like I said, I'm not a biological office. Some people aren't specifically seeing me for these things, and maybe they do just want to do what their insurance covers. That's their health. They get to make that decision. But if I can start telling patients, we can do more. We can really figure out more things to do. I'm here for it. I can do my own internal marketing saying, hey, did you know I can test your saliva and look for, X, Y, and Z that are markers for your health? So those are things that I can do as a hygienist in my practice. Those things, educating patients, is what has kept me engaged and excited to go to work and wanting to do more and learn more. have conversations with providers like yourself that are like-minded and really just wanting to see change as a provider, but even as a patient. I want a great provider, right? That's the best thing I can do for my community, is become a really great provider.
And I bring it back to the metaphor for a couple of reasons, because I think we always are passion if we don't feel that we're helping. We really came in this field to be healers, all of us, right? We want to be impactful. There's no bigger compliment than when we come back and say, you really impacted my life. That one little thing you did for me, that's where you bring your passion back, right? I'm not saying that you can work in any toxic environment, and I don't think people should work in toxicity, but you got the power to change that. And you guys are really at the forefront. The more I look at this the strategy that we could create, we have to blend the two, right? So the dental hygienists can start that educational process. They can start to look at a functional approach and then help guide the person in the chair to the right provider and work on that body again holistically. So I just want to encourage everyone out there to really know your value. And if you don't feel passionate what you're doing, follow along. Maybe Heather and I can bring that passion back past some clinical cases. Hey, this is where we were. We weren't quite sure what we were doing. The person trusted us. We took it, we developed it, and hey, this is what we did in a year's time. So I really hope that we will change and get more excitement for all of you back and get you ready to go back and work again and feel passionate about what you signed up for.
Louder for those in the back.
And I'm going to challenge you guys to do that. And then I'm going to challenge you to find practitioners like me that's hungry to learn. And with that, I think we really can impact health. And then it'll be a ripple effect. It'll be a domino effect. People will be eager, and then the oral biome, oral systemic health won't sound so strange. And I can't think of a better time. Sorry, Heather, to cut you off. I can't think of a better time because I keep hearing the statistic that 15% of the population right now has one autoimmune disease. Autoimmunity is on the rise. I am convinced 85% of autoimmunity either starts with the mouth or involves the mouth, chicken or egg. And I don't know that you can settle on which one it is because, again, it's one long tooth. And again, this is the last thing I'm going to let you guys start talking again, but I always tease my patients just to kind of break the ice. They made complex medicine too hard. And this is part of a PRT or someone else that brought this up. My favorite game when I first meet a patient in my head is, how's the person going to die of complex illness? Because it's really not that hard. It's either type 2 diabetes and complications, cardiovascular disease, something of the brain, Parkinson's, multiple sclerosis, or cancer. And the themes of that is what your inflammation stance is and what your immune system is doing. It's really that simple for complex. So all you have to do is know the person's occupation, look at their medical history when they come in, and you got an idea of what horseman they're going. And then you look for that in the mail and you get them to the right provider, you're going to knock it out of the park. That's the healing story. So again, for whatever that's worth from my side of it, I do hope to, again, instill maybe value back in the job that we're doing every day. It's not just a job.
That is such an interesting perspective. So I will let you have the conversation, Heather, but I just want to say that is such an interesting perspective because I definitely cannot say I have thought more than a handful of times, like, how is this patient going to die? That's not something that we deal with, right?
Yeah.
I think worst case scenario is this patient's going to lose their teeth soon.
And I think that's the importance of salivary testing and checking the nitric oxide levels and looking at pH of the mouth to do it. Like I teach all the time, hygienists in messaging, the salivary diagnostic isn't another thing you have to sell in the office. It's a diagnostic tool to understand risk factors, both orally and systemically. And we can test before disease starts to find those dysbiosis. I think that's true prevention versus reactionary dentistry where we're waiting for bleeding points or bone loss or decay to happen. You can look at kids. I've seen 14-year-old kids with halitosis issues, and they come in through the bristle test, and they're a perio nightmare on the microbial side. Like that person hasn't started their disease process, but boy, we have a chance to subside that super early and prevent both oral and systemic disease. So it's not something you have to sell. It should be, in my opinion, standard of care to start looking at what the hell are you treating when you're treating your patients? And can we subside that way before disease progression actually happens? We're already too late if we're testing our perio patients. We are too late. That happened when they were 14. And then that inflammatory cytokine response caused the autoimmune problem that periodontal disease is. So back to the autoimmunity, right? Autoimmune disease is perio. Perio is autoimmune. The bone is going away. It's just like rheumatoid arthritis, attack of the bone in the joints. So we need to start thinking outside the box, put the head back on the body, and start thinking a lot more diagnostic. Like you said, Karen, I think it's probably even more valuable than some of the x-rays, because when we're looking at the x-rays, we're looking for disease progression before we're actually diagnosing. We can test way before and be able to understand disease pathways for our patients way before disease actually takes place. It's magical. And I'm, done with my rant.
What you just said to me in my medical mind is that an oral diagnostic test is as important and should be expected to be part of your care as a mammogram is for a female.
I believe it is.
Or a pap smear. I mean, really, what is the difference? I mean, who would have thought a pap smear could have told you, and what woman would allow a pap smear? If we got that across as an expectation and a standardization, again, the oral biome, we just got to change the lens.
Yeah.
Over and over again. It's not an upsell. I'm not upselling my patients to do an oral biome test. I'm using it as how can I prevent health for you?
Yes. Awesome. We should probably think about wrapping up.
I know, I was gonna say, this is like a good, like, little chunk right here. I can edit this part out.
Yeah.
I want to share a story. Since you're in OBGYN, Karen, when I was in hygiene school, we have been going to the same OB, like my grandma, my mom, my aunt. She's just like the family OB. And so I was in hygiene school and I was going in for my annual checkup. And my OB, she is hilarious. She is one of the funniest ladies ever. And she's, super nice in the middle of getting me ready to take the pap smear. And she's like, "Oh, so you're finally in school. What are you studying?" And I'm like, "Dental hygiene." And she's like, "Oh, teeth. I just cannot." And I was like, "Where are your hands right now?" I said that to her. And she goes, "Yeah, but vaginas don't have teeth." And I was like, "There's other things. Are you kidding me?" So it's just so funny to me I don't know, what is tolerable to other healthcare providers, because Heather, people come in to see us all the time and like, "Oh, mouths are so gross." And I'm like, ugh,
I hate
nobody
coming to
has
the
peed
dentist.
on me. I have never wiped a butt in my life. I have a better profession than other people, my opinion.
It's all about perspective, isn't it? That's what my point of that. It's a little bit about perspective.
Awesome.
Perspective.
Well, we're definitely going to have you back, and hopefully we can share some of our journey together as we work collaboratively. And I hope to share the idea of collaboration. I'm hoping to inspire other hygienists to start, as we start working towards autonomy. I think when we're talking about access to care, how cool would it be to have a hygienist with an office in your practice and be able to treat and do the care right in your office, Karen, where we wouldn't have to find that biologic IOMT, IABDM dentist, and you could have, a hygienist on staff with you specifically to help treat. I see that for the future of dental hygiene, and I really hope that some of the groups out there who are fighting for autonomy and the ability for hygienists to practice independently, so like there's a few states that we can do that and we would be able to set up. I think it's important, maybe even for doctors, to start writing into some of these ADA things and having the conversation. Like, I wish I could have a hygienist in my practice. I see the oral systemic connection.
Yes.
We need to empower hygienists as preventative specialists in oral and systemic disease. And I think, Karen, you and I know there's some other hygienists out there that are working collaboratively. And Rice, we just interviewed, she's been working collaboratively with, doctors on the oral systemic connection. I see this as another avenue. And I'm just doing it on the oral microbiome. Like, I spend an hour talking about oral care, how it's connected to the oral systemic aspects, giving precise hygiene instruction, making sure that they can floss, use proper brushing, and then getting them to someone. So I hope to see the future of dental hygiene being access to care, being more in the dental setting, the medical setting. And maybe we can bridge the gap and be able to have practices within medical settings. So exciting.
I take this as a challenge, and I take that as we're going to make that happen. We're going to make that the new standard, Heather, and we're going to show that through the work that we're doing, hopefully together, and then to springboard that off as having other people follow what we're doing. So I'm super excited. And for all the listeners out there, I'm happy to come on anytime you want me to come on, right? I just need to know what you want to hear. I want to know what you want me to target on. So super exciting. Look, I've been doing this for 30 years. I think this is audio, not video. So I think I look pretty good for doing this for 30 years.
I would agree. When you initially said that, I was like, but you're like 40, right?
all for myself and that. But you know what? I really feel like I'm just getting started in medicine. And it's so
awesome.
fun for me. So I'm just really super grateful to be part of this ride. And I can't wait to see where it takes us.
Yes.
Oh,
Yeah.
okay. Closing questions. We love asking, what is one thing that you're reading, one thing you're listening to right now?
I didn't expect that question. Really, most of what I'm reading right now is about dental. Heather, what's the book that you just challenged me to read? The whole dentistry? What was that?
Whole body dentistry, yes.
That's what I'm into, but I'm ADHD book reader. I will read a third of the book and then get excited, and then it tracks me down to another rabbit hole into something else. But that's the one that I'm packing for my vacation today. Yes, I'm going to read a dentistry book on my vacation. So
Yes, I'm like, yeah. Every time I'm on the plane, I'm like, yep, the dental diet. Here I am. I love that one's like so good right now. Do you listen to podcasts?
I mean, I have such little time in my life right now. That's not an excuse, but I'm really working hard on building the oral systemic part of my business. And so I don't have an opportunity as much as like I used to. I don't want that to be for long. And I'm training some nurse practitioners to come on board with me. So that takes a lot of my time. But if I have podcasts, I'll be glad to listen to them. I get sent podcasts all the time, right?
Yeah.
And there's only so much time in your pie anymore. So my time right now goes to working with Heather and building this and revising our program to just tweak it once more. Why do you ask that question? Gives you insight into where people are, or?
I think just like another resource, because everybody's in like a different niche, different headspace, right? Like Heather and I listen to similar podcasts, but not all the same. So it's just always something to learn from our guests, is especially because you're in a different space, right? You're not specifically dental. So always finding a new resource is just really fun, and yeah, resource.
Yeah, I'll throw this back out to the listeners because I don't know if you have a chance for them to ask questions or input back on your program. You probably do in some way. I'm not saying that the oral frontier is anywhere near being closed for me. I mean, I'm just beginning in this space, right? What my next space and what I have to hear. So listeners, if you have some good ideas for me or podcast, I have to find a good ENT. I have to find more. I have to grow my knowledge now in the sinus area. Sleep, I think we know good. Sleep, airway restrictions. Sleep is still a frontier. But ENT, sinus work, if they're podcasts, again, I said at the very beginning or somewhere during this, I got where I am for the people that challenged me and helped me get here. So for the listeners, you know a good podcast on sinuses, you have information. That's what I need. So, Amanda, for you, I'll read this book. ENT, sinus work is my next frontier.
Yeah, interesting. Okay. I'll be honest, that's a new one to me. So thank you. Thank you for sharing.
And honestly, I think it's the new one for everyone. I no insult to the ENT out there, but you go to an ENT and they wrote a rooter or it's a Flonase here and a Flonase there. So I'm not saying that there's others that's not doing that. That's just my experience so far. And it's probably because I haven't found the right person, honestly. I didn't know Heather existed. I went out and found her, or she was brought to me. So
We lucked out and met through Bristle. And then I was like, hey, I want to work with you. Yeah.
I think she was a little stalkish. I admit it. That's why I had that date too. I some stalked her for a while here. Don't think I'm some creepy, weird person. But
It's okay. This ended up being a wonderful working relationship, and we're learning from each other. So it's awesome and super excited. So Karen, if someone's interested in seeing you as a physician, where can they find you?
I'm in Grosse Pointe, Michigan. You got to come on to elevatehealthgp.com. We've got a pre-streamlined there, so we're accepting new patients. And please come aboard.
Yeah, and you'll get to meet me if you do that with Karen. So you get us as a duo team. It's awesome. So
Listeners, we don't know. We haven't even met in person yet. I can't wait for that meeting, right?
I know. Yeah, we're gonna have to go on vacation together.
But this is like less than a year relationship that Heather and I have, right, Heather? It hasn't even been. We haven't had our first year anniversary yet.
Yeah. Yep. Lots of great things to come.
Us either.
Yep.
You're an HC together.
Surround yourself with the people who grow you,
Yes.
support you, and excite you. I think that's what's important for preventing burnout, right? Is finding your posse. I'm super excited that you guys are part of my posse. So
Yeah, me too. Listen, thanks again for having me today. I really, really super appreciate it. And I hope the listeners enjoyed us rambling and our non-structured approach today.
yeah, awesome. All right. So thanks for tuning in today for today's episode of Functional Roots Podcast. Don't forget to subscribe and follow us and stay connected. If you have enjoyed this podcast episode and found it helpful, we'd love it if you could share it with a friend. Thank you so much, Karen.
Yeah, you're welcome. Thanks for having me.
Thanks.